name is Konrad Styner. I'm a doctor of medicine. Tonight's story has the title, White is the Color.
Guardian of birth, healer of the sick, comforter of the aged. To the profession of medicine, to the men and women who labor in its cause, this story is dedicated.
This story has a single point to make, the struggle for the preservation of life. It centers around the men and women who have dedicated their lives to that struggle. Their title, Doctor of Medicine. There's too much dignity and too much suffering in the fact of life to justify any romantic compromises with truth. There's excitement enough and triumph enough in truth. Tonight's case in point, Estelle Alberta Collins, 29 years old. She was married 7 years before the first baby began. That means a lot. In her 6th month of pregnancy, she began to develop symptoms I didn't like. And 2 weeks later, April 11th, the final answer was spread out on a glass slide under a microscope in the laboratory of Dr. George E. Fletcher, hematologist.
Not much doubt about it?
Not in my opinion. Want to try to get Dr. Styner for me?
Yes, sir.
Dr. Steiner's office? Oh, yes, Dr. Fletcher. Yes, he's right here. Just a moment, please. Dr. Fletcher with a report from Mrs. Collins.
Thanks. Hello, George. How are you? Not too bad. A little busy. George, you work up the report on Miss Collins? Yeah. Huh? What's your impression? Huh. Yeah. I see. No, I guess I was just looking for a miracle. All right, George. Thank you. We got a phone number for Miss Collins' husband? Place of business?
Well, I believe he works at home, if I'm not mistaken. A commercial artist or something. Excuse me, Doctor. Let me see.
The laboratory report was far from encouraging. It was the last thing in the world I wanted to do, but there was no choice. I called the patient's husband, a self-employed commercial artist, and made an appointment to meet with him that night in my office. Because of her condition, I asked him not to mention it to his wife.
Larry, what do you think?
Nice.
Covers it pretty well, doesn't it?
Yeah, but what do you wear when you're 8 months along? A puff top?
I hear you talking on the phone?
Yep.
Who was it?
Holloway. He wants to talk to me about some layouts at about 6.
I can use the business. Do you know what they want for baby buggies these days?
Money?
Too much.
Well, we always can give Junior away. Think of all the cash we'd save.
Not on your life, Buster. It's still kind of hard to believe, isn't it? Our own baby.
7 years. A long time making the grade.
We start slow. We finish strong.
How you feeling?
Pretty good. Still kind of tired. I don't feel like doing a thing.
Well, buck up, little mother. It'll all be over in 3 months.
That's when it starts. I don't think it'll be too much trouble to you.
Well, I'll tell you about that when you get up for those 2 a.m. feedings.
20 minutes past 6 that night, Collins knew the truth. I explained it was a rarity, 1 case in several 100,000. It wasn't much comfort. It's one of those few things a doctor never forgets. The look of a man who's just been told his wife's going to die. Thinking about it isn't going to help.
How do I tell her? What do I say?
It's going to come as a shock to her. I think she'll take it pretty well in stride.
Well, maybe if we took the baby, don't you think
I already told you.
Does she have to know? I mean, if we didn't tell her...
Just a question of time until she starts asking questions. It's only fair she ought to be told.
I can't tell her. Would you tell her, Doctor?
All right. I'm going to drive out with you now, then we get it over with. Better.
Oh, no. How about tomorrow sometime? You know, she'd be feeling better. You know, sometime in the morning.
All right. How about 11 o'clock?
Yeah. Well, I guess I ought to go home.
Come to Mother, tell her everything. What's the matter? Would you like that little nasty $3 steak we had for dinner?
Oh, it's nothing. I was just thinking.
Yeah?
Don't forget the latest news and sports in just 5 minutes.
How you feeling, Stella?
I don't know. What have you got in mind?
I didn't see Holloway tonight. That was just an alibi. I went to see Dr. Styner. I was him on the phone this afternoon.
What does he want?
It's going to be rough, Stella. Rough as it comes.
You sound like you're going to club me.
I am. Styner wanted to make sure. He had a couple of the other doctors check it. They went over the whole thing.
Went over what? What do you mean? The baby. Oh, no. He said we'd lose the baby.
Well, Styner said everything went well. The baby be a normal, healthy kid.
Well, then what is it? Tell me. Larry, don't be silly. Tell me, what is it?
It's you, Stell.
Me?
That's why they took all those blood tests.
Why?
Well, there's something wrong with you. It's leukemia.
Leukemia?
Something to do with the white blood cells. It's no good. There's too many white blood cells. It's no good.
Well, what does it mean? What do I do?
It's acute leukemia.
Well, what happens? How do they treat it? Do I take shots or something?
I'm going to give it to you straight, Stell. It's fatal. They can't save you. You want the rest? It's fast. They can prolong it a while, that's all.
How long, Larry?
I don't know.
A year? 6 months? Less?
We'll see Dr. Styner in the morning. He can tell you better than I can.
And the baby?
Good chance the baby will live. Pretty good chance.
Yes, you're right. Pretty rough. I never thought much about dying before. The pain in the neck. Larry. Larry. Hold me. Hold me.
This may help to give you some idea of what I'm talking about. You see, among other things, the bloodstream is composed mainly of blood cells, red blood cells and white blood cells. Now, whenever there's an excessive number of either one, it's a pretty sure sign of danger. And in your case, it's the white blood cells. You understand?
I think so.
Well, let me see if this will make it a little more clear. You see, the red blood cells carry the supply of oxygen to the tissues in the various parts of the body. Now, when the red cells are crowded out by the great number of white cells, that supply of oxygen is gradually choked off. I'm oversimplifying, but in effect, that's what's happening.
I see. And there's no doubt in your mind?
I'd be lying if I said there was. The symptoms, the condition of the lymph nodes, spleen, your general tendency to hemorrhage, that could point to several things. But the laboratory reports narrowed it down.
You mean the blood test?
Blood test, chest picture we took, and especially the examination of the marrow specimen. Miss Collins, I've had the opinion of experts, and it all points to one thing.
I see.
You might keep this in mind. The doctor's only a human being. He can make a mistake just like anybody else. He's not the Almighty.
And my baby? You're sure it won't affect him?
For some reason we don't understand, the leukemia stops at the placenta.
He'll have a good chance.
If he's 8 months along when he's born, I'd say he'd have a good chance.
You think I'll last that long? Honestly?
Well, it might even be longer. We can't say. One thing I can tell you, we're going to help you all we can.
How?
But we've got to understand this. It's not a cure. It's what we call a palliative treatment. See, in your case, the use of X-ray therapy is out of the question. It might harm the baby.
Oh, no, I wouldn't want that. The baby comes first.
Well, there are some drugs that have been developed. They won't harm the baby, and they could help.
And they might give me a little more time.
Well, the more effective the drug, the longer the time you'll have.
And the longer I live, the better chance the baby has.
That's right.
I guess it's silly. Do you think I might do it? Live long enough to see the baby born?
Right. It's possible.
It'd be kind of nice to see him, wouldn't it? See what he looks like. The color of his hair. To see him just once. Just once. Doctor, do you think I'm asking for a miracle?
Well, you go ahead and ask. I've seen them happen. April 20th, 7:30 p.m. The patient, Estelle Collins, accompanied by her husband, arrived at St. Charles Hospital. She was in her 26th week of pregnancy. Her fight for life had begun. Not a fight for her own life. That much was hopeless. She realized it. She accepted it. The fight was for the life of her unborn child. If it was to have a good chance of survival, she had to fight death for at least 6 weeks. The leukemia had no association whatsoever with her pregnancy. One of the critical moves in the struggle for the life of the unborn Collins baby was made the following morning, April 21st, 10 a.m. Those directly associated in the case: George A. Fletcher, M.D., hematologist; Averill B. Morrison, M.D., hematologist originally consulted; Arnold James Wesley, M.D., St. Charles Hospital resident physician, and myself. Initial therapy includes prescribing for the patient a daily dosage orally of 0.5 milligrams of a folic acid antagonist, amethoptrin. It's a drug designed to reduce the excess number of white cells in the blood, to destroy them at their source. In some previous cases, it's proved toxic. How the patient might react, we have no idea. Also, we have no choice. Whole blood will be transfused as needed. April 30th, 2:30 p.m. The dosage of 0.5 milligrams of amethoptrin has shown some effect. White count 60,000. It's possible the drug is retarding the progress of the disease. In any event, the baby is 9 days closer to life.
Look, now there's going to be no argument to the name, no matter what your mother says.
Okay.
Lawrence Randolph Collins, Jr. Promise?
Yeah. Unless it's a little girl.
Then you can name it after your mother.
How they been treating? Food pretty good?
It's all right. The nurses or something. Too bad you can't be around to hear it.
What do you mean?
Every night. Regular. 11 o'clock. We start playing shuffleboard with the bedpans.
May 12th, the patient's white count 80,000. She sustained 2 minor internal hemorrhages to date. May 18th, the patient is approaching her 30th week of pregnancy. White count over 90,000. No sign of remission. Patient steadily declining. A complete setup for possible emergency surgery is placed in the patient's room. May 26th, the patient has sustained additional internal hemorrhages. The dosage of amethoptrin has become toxic. Patient's mouth is inflamed. White count 100,000. Chances for the baby's survival We can't be sure. Dr. Styner. Yeah, Wesley? Another hemorrhage, when'd she start? You move her up to surgery? Yes, move her up there now. Wesley, you call Mr. Collins? Call him. All right, Wesley, I'll be right in. Yeah. I arrived at St. Charles Hospital a few minutes past 3 a.m. Preparations for surgery were just about completed. I changed my clothes and went immediately to the scrub room. The hospital resident, Dr. Wesley, was standing by to assist. How's it look, Wes? Pretty sour. Still hemorrhaging? Yeah, seems to be. How is she?
Poor. Pressure's way down.
Respiration?
30. Very shallow. Pulse, weak and thready. About 140. I'm assisting her now.
She's on her third pint now.
Just a minute. Can't get a pulse.
Check the heartbeat.
She's gone.
Fetal heart's still there. We lost one, now let's save one. Nurse?
Ready, Doctor?
Night. It's a girl. Tissue scissors. All right. We got a sleepy baby. Let's get over the table. Color's fair. Let's see if it'll breathe. No response.
Warm blanket.
All right, stethoscope. Now, heart tones are good. Strong, but they're rapid. At least 170.
Sterile gauze, Doctor?
And clean out the mouth. No breathing?
No, Doctor.
Trachea catheter. Mouth. Throat. Trachea clear. Almost once more. Warm blanket. Chlorine.
Chlorine, 3 minutes.
How long's the baby been out?
2 minutes, Doctor.
Come on, let's have that chlorine. All right. It's getting weaker. I go 5 or 6 minutes without breathing.
Never knew one to go any longer.
My heartbeat's getting irregular. Caffeine, sodium benzoate. 3 minutes.
Right.
Give me the ether. Come on, let me have it.
Caffeine, sodium benzoate.
Wait a minute. All right, put it in the cord. Ready with the positive pressure?
I'll get it in a minute, Doctor.
Where's the catheter? I'll breathe for it.
Positive pressure machine's ready, Doctor.
All right, ma'am. Turn it on, 30 cycles.
30 seconds. Can't go much longer. No response?
Nothing?
No oxygen. No nourishment. Turn that off. How long's it been now?
6 minutes. Any response at all?
Contrast breath. Come on, move.
Here's the hot water, Doctor.
Come on.
Here's the cold, Doctor.
Hot. Cold. Hot. Cold. Hot. Cool. Hot.
Breathing, Doctor.
Cold. Hot. That's the way. Thanks, boss.
Well, I better get a move on. I'm in surgery this morning.
Thanks again, Wes.
Dr. Styner,
Yeah.
the husband's outside. Mr. Collins,
Tell him I'll be out and talk to him in a minute.
do you want me to tell him his wife died?
No. Tell him his baby lived.